So whatever the general parts are there, you can just also check in your notes, and I'll be just explaining whichever is relevant and which is important over here. Okay? Because I need to quickly move on to the next one. That's very, very interesting, and I love that. Okay. And effect of health and nutrition on learning. So this is your chapter. Yeah. So, introduction. Can you see somebody over there? How's the child looking? Looking normal? No, very dull, right? The child is malnourished basically. Okay. So, coming to the introduction, there is always what they say, health and the learning. Always it has a very strong relationship. So if your health is at stake, definitely the learning process will be affected. You all agree to that, right? So always, because I told you in the first chapter also, especially in the preschool years, kids are very, very prone to lots of infections because their immunity is down and lots of other factors where the growth is just at the beginning stage, and a lot of organs and the system are not that well matured in young learners. That is the early 5 years of age. So what happens is, in case during this stage, if the child has a compromised health, it directly impacts on the learning. So that's a study, and that scientifically has been proven as well. And what happens is, there is an overall lack of healthy living and eating in society as a whole. So it so happens like we might be able to give the nutritious item to our children, but there are so many people those who cannot afford that, right? So for them, definitely we can't give that balanced nutrition. So even in case if you see kids from the African countries, so where you can see them totally malnourished, these are all categorized as the underdeveloped nations. Even actually, frankly speaking, India also comes under the underdeveloped nations, but now the scenario is getting changed. It will take some more years to get changed, right? So, why all these are important is because once they do this survey only, because these are important when it comes to the fundings, basically. So for the government, in case if they have to give a report, they have to give a properly studied report. So only then they will be giving out or fixing up some type of budgeting in the, whenever they do this annual budgeting, some type of amount for the preschoolers. So until unless we give them the problem, what is the problem, the solution cannot be given, right? So that's the reason they do all these studies, and what they have seen here is the health related factors such as hunger, physical and emotional abuse, chronic illness, lack of adequate nutrition can lead to poor school performance. Okay. So this is generally basically, we are considering the preschool years. It is extendable even to the later years as well. As and when the child gets into the primary and the secondary and the higher secondary and all. Okay. So, and the poor nutritional practices not only leads to many health problems, but also result in the major student achievement. But student achievement will be very, very less. Not expected to that age. He cannot come to that age, whatever is expected. For example, a 10-year-old child is expected to complete all these tasks within a stipulated time. The child will not be able to do it so. Okay. Minimal. Okay. Less, what we call. The schools are greatly affected by the inadequate diets of their students. That's the reason many of these schools, nowadays even we do have schools over here in Bangalore, where schools provide the food. They do have their own canteen, they do have their own nutritionist, so the schools provide the food. Of course they do charge for that, but okay. But what they say is, the child, at least when he is in the school premises, at least in a day, at least for one time, he will be getting that balanced nutrition. And nowadays parents are also accepting that very easily and very happily, because they also do not have enough of time to take care of all those stuff. Okay. And children who lack essential vitamins, minerals, fats and proteins are victim of reduced cognitive function. These are all the major nutrients which are the vitamins, minerals, fats, proteins. So carbohydrates doesn't come here because I told you previously also, because carbohydrate sources are found in abundance. That means we do have a huge resource of carbohydrates. What? This one, is it? Shall I switch it off? Okay. Just don't think for the examination point of view. Repeating that point, don't think for the examination point of view. Just learn for your knowledge. Definitely you'll get questions from this, that's a different topic. But now when you are learning about this, just learn, keeping your examination point aside. Okay, so before children reach school age, they must negotiate a threat of number of diseases which are very common in the early 5 years of age, right? So more than 50% of child deaths are caused by pneumonia, diarrhea, malaria, measles, malnutrition and HIV. These are the common illnesses where there is child death nowadays because of the a very good technology as well as a revolution in the medical field. We do have the child death rate has come down drastically. But earlier days, it was very common with pneumonia. Pneumonia was one of the deadly infections. When pneumonia for small child, matlab, it was like idhar ya udhar, that's it. Because we didn't have good effective antibiotics during those days. So pneumonia, diarrhea, malaria, measles, malnutrition and HIV. Malnutrition because of all the reasons which I have just discussed earlier now. Then children in the age group of 0 to 14 years are the important age group in all societies because this is the young generation. So these are all going to be the future ones, right? And since they constitute about 40% of the total population. 0 to 14 years, they constitute about 40% of the total population. And they are most vulnerable to disease, death and disability owing to their age, sex, place of living, socio-economic class and a host of other variables. Clear with this? Just an introduction. Now coming to the actual one. So for our study purpose what we do is we usually divide the childhood into these ages. Okay. So one is called as the infancy, that is up to 1 year of age. That period is called as infancy. So in this infancy also we have two periods. One is called as the neonatal period, that is the neonatal. Natal matlab baby. Okay? Natal means baby. So neonatal period, first 28 days of life, and post neonatal period, that is 28th day till 1 year. Why they are categorized like this is because in the neonatal period there are some diseases which are very common, illnesses which are very common, and post neonatal period also there are some illnesses which are very common. That's the reason they have these two categories over here. One is neonatal, in the infancy up to 1 year of age, that is first 28 days of life. Then post neonatal, 28th day till 1 year. Then we have this preschool age, that's 1 to 5 years of age. Then finally we have the school age, that is 6 to 14 years. 14 to 16, some people 14, 15, by 14, 15 they complete their 10th. So 14 years they have considered over.